And good afternoon, and welcome to another episode of Territories Talk. And today we are blessed to have in our presence two young Bermudian ladies. Let me make sure I say this properly. Akilah Lapsley-Dyer and Pashe Douglas-Sampson. Good afternoon, ladies. How are you doing today?
Fine. Good afternoon. We're fine.
Okay. And I'll allow you the privilege of introducing yourselves to the audience.
All right. So good afternoon. As stated, my name is Akilah Lapsley-Dyer. I am an occupational therapist in Bermuda.
Okay. Good afternoon. I'm Pashe Douglas-Sampson, and I'm also an occupational therapist in Bermuda.
Okay. So thank you for that, ladies. So for those who don't know what an occupational therapist is, could you kindly educate us?
Okay, so occupational therapy is a healthcare profession. It's a healthcare profession that works with individuals that have gone through some type of trauma, have experiencing some disability, chronic illness of some sort, something that is preventing them from performing meaningful activities or meaningful interventions, meaningful activities in their daily life. So everything that they do to live. So their skills for living, if they're having issues with that, that's where occupational therapy comes in.
Ms. Lapsley-Dyer.
So basically, from the minute you open up your eyes to the minute you go back to sleep, whatever you do throughout that day, such as brushing your teeth, getting dressed, getting to work, eating, are all activities that we will be helping you with.
Okay. So what does it, for those who don't know, because a lot of people like myself don't know, what does it take to become an occupational therapist?
Okay, you will have to go to college or university, and you would have to get a degree in occupational therapy. Both our routes are very different, but in order to work in Bermuda, you would have to graduate from a WFOT, which is World Federation of Occupational Therapists, sorry. You would have to graduate from a college or university that is accredited by our World Federation in order to be licensed to be an occupational therapist. So right now, the criteria is at least a master's degree, but there are doctoral degree programs out there for occupational therapy.
Mm-hmm. And that would take, master's degree would take what, good 5-6 years?
So no, a master's degree can range from say 2.5 to 3 at present, but then it depends on the school and where you study, whether it's in the US, Canada, or the UK.
Right.
Okay,
so
so
in
that
the US is typically, in the US is typically 4 to 5.5 years for a bachelor's and master's degree.
Okay. And where did you all respectively study?
So I studied initially, I was at Temple University doing my undergrad in sociology with a health focus. And then I did my master's in occupational therapy at Thomas Jefferson University in Philadelphia. And that was a 2.5-year program as it was just for my master's.
Okay. And you, Ms. Douglas?
I went to Quinnipiac Douglas-Sampson, yes. I went to Quinnipiac University in Connecticut. I was there for 5.5 years. I got my bachelor's of science in health and science studies. I continued on to get my master of science in occupational therapy. And then I worked for a little bit before I decided to go back to school and get my doctorate in occupational therapy in 2018.
So I should be addressing you as Dr. Pashe Douglas-Sampson.
Yes.
Okay. Okay. All right, doctor. So in Bermuda, how many occupational therapists do we have in Bermuda?
So right now we have registered about 35 who are currently practicing.
Okay.
And that
others
will be, go ahead.
Sorry, yeah. Sorry, go ahead.
So that would be between Bermuda Hospitals Board, Department of Health, and private practice.
And is that enough for Bermuda?
No, it's not.
So we definitively need more occupational therapists in Bermuda.
The simple answer is yes. When you look at our population compared to the amount of therapists that's here, it's significantly low.
Okay, so that leads to this question, is there a ratio of population to how many occupational therapists it should be?
There's not a specific criteria or ratio out there that will determine that. What you would or should be looking at is how the population is divided. So you will look at the elderly population, the over 65 population, young adults, children, and then birth to 3. So you might split up the population like that and see where the need would be. And as you know, in Bermuda, we have a very large population of elderly or over 65, and occupational therapists are keen to work with those individuals. So with us being so small and that population being so large, it's just not enough of us to go around.
Okay. So let's just again to educate ourselves, or myself and the listening audience. What does occupational therapy look like for young persons, and what does occupational therapy look like for not so young persons?
Okay. When we think of young people, they are new to this world. They have to learn skills for the first time. So we'll be trying to work with them to get them to reach all their milestones and get them to develop those skills, because it's the first time for them. For the older people or for the adults, they've already learned these skills. Most of them have. So now we may have to teach them new ways of learning these skills or having to relearn the original skill.
Yeah.
Mm-hmm. I see. Very good. Very good. And when it comes to servicing your clients, do they come to one set place, or do you make house calls, for lack of a better term?
So it depends on where we work. So for the hospital, they have a day hospital, both at King Edward and at MWI. So the individuals would be coming to them for the most part, or they would see them as inpatients. So their staff house there at the hospital. For us, both at Department of Health, we actually go out. So whether that's the seniors going out to their homes, seniors' homes, or actually going to the schools, or the child's, if it's an infant, to the child's house. We do also have a clinic, but most of that is for, I would say, the birth to 3-year-olds that will come to our clinic.
Okay. So let's go back to the fact that we need more occupational therapists. What can be done to encourage more Bermudians, or not necessarily even Bermudians, but encourage more persons to get into the profession?
That's a loaded question, because it's not just about recruitment and no, it's okay. And it's not just about recruitment and actually getting out there and talking to students to see where their interest is, and seeing if we can, try and see if they will even pursue occupational therapy. It's also getting the population itself to understand what occupational therapists do and how we may benefit the entire community. So we can say, yes, we'll have all these students coming back, but then do we have the healthcare facility or the healthcare system to support all those therapists that are coming back? And then do we have the patients that understand that they may need occupational therapists if they do go through something?
I see, because one of the things, as you all know, and as others are slowly learning, is that there's a term called the graying population, which means the percentage of your population that are 65 and over. And more persons, through medical science, better food, better lifestyle, more and more persons are over 65, are living to 85 and 90 years old. So that's every country in the developed world is going to see that their population of 65 and over are becoming like almost a third of the population. So that's the graying population. And so for those of us who are just before the graying population, what are some of the things that we should do to prepare ourselves to in that manner?
So some things to look at is, well, of course, your overall health. So how your body is moving, how your lifestyle, making sure that you're keeping active, both cognitively and physically. In addition to that is, um, it's a difficult question to touch, but if you do have extra finances, looking at how you can change or modify your actual home to accommodate the growing age of yourself or anybody else in your household. For example, in Bermuda, we have homes with lots of stairs, small doorways, low toilets, small and low tubs, which become a challenge if you as you get older, as well as if an injury is to occur. So different things like that are definitely things to start looking at. But they come at a cost.
Yes. Well, one of the things I know through, I'm not sure which ministry started, but one of the things that through Age Concern and others, they do provide some sort of funding for persons to modify the homes in order to accommodate aging parents or they themselves. So it's like you have a lower cabinet space, if that's correct. And then the access to the bath. Some people can't use a tub anymore. They need a tub with a door to the side or something like that. Or now you have if you have a two-story house, upstairs and downstairs, a lot of people now have the mechanical chairs that take you up the steps.
A stair lift.
Stair lift, sorry. Yeah, right,
That's
stair lift.
okay.
So this is all part of occupational therapy, correct?
Yes.
It is.
Because one of the things that my generation being 50-ish, right, is that we're starting to become a little bit more aware of what we need to prepare ourselves if you live that long, another 20 years, when your body parts start breaking down on you and cognitive dissonance. So there's all these things that whatever's going to cause today, even if as Ms. Lapsley-Dyer said, yes, it's going to cost you, but whatever it costs you today, it's going to cost you a lot more 20 years down the line, not just in money, but in your health. Because if you're constantly stretching to do this or doing that, you could be pulling your spine out of shape and all these sorts of things, right?
Right.
You all have a big event coming up. You want to tell us a little bit about that?
Sure. We have our World Federation of Occupational Therapists. They are coming. They have been coming this week. And we are going to have our council meeting and executive team meeting. So that means that the Bermuda Occupational Therapy Association, where we are both executive members, we had submitted a proposal to the World Federation in order for us to co-host the meeting here, and we were successful. So they had chosen Bermuda to have this meeting. Thank you. So this is a big opportunity for Bermuda. It will definitely showcase Bermuda, and they will be looking at our actual practice of occupational therapy here. So they'll be learning about what it is that we do, why we do it, why it's so unique. And then if the challenges that we have put in the proposal, they'll be trying to help us address those challenges so we can move forward with our profession.
And first of all, how many, we have a question coming in, we'll get to in a few. How many member states are there in the WFO? And of those member states, how many are sending delegates to Bermuda?
So I believe it's about 109 that come under the umbrella of WFOT, and about 65 plus are actually coming to Bermuda.
Oh, okay, cool. And where is this conference being held?
It's being held at Hamilton Princess next week.
Okay, which day is it open to the public?
Sorry, it's going to be Thursday to Sunday next week. So all the WFOT delegates or WFOT delegates from around the world will be coming here next week, and they'll be having the council meeting at the Hamilton Princess for 4 days.
Okay. And is it open to the public or delegates only?
Unfortunately, it's not open to the public. It is only open to delegates and then any observers that we do submit to go. So I am the WFOT delegate for Bermuda, so I will be going. And then we have an observer going, Mrs. Sharon Godwin. She is one of our founding members of our association who has graciously accepted our invitation to join us there.
Sharon Godwin, you said?
Yes.
Okay. Okay, so we have a question came in from Ms. Maureen True. Good day. Are there any opportunities for some employment for students who are currently studying OT, occupational therapy?
So yes, there are opportunities. They would have to go through the Bermuda government summer program. I believe that's through labor and training, and sign up.
There's also the Bermuda Hospitals Board summer program that do offer opportunities for OT students.
Okay, and what would you say to encourage, I'm not sure who the person may be, but what would you say to encourage them to join your profession? Look, they're studying anyway, but what moral boost would you give them?
Well, for us, like we are the association, so you should definitely reach out to us so we can help you if you have any questions with anything that you are going through or any of your coursework. Like we've been practicing for some time now. So, and we know what it's like to have to go through health science school. It's not easy, it's very tough. It takes a lot out of you, but it's something that you're passionate about. So we will just try and encourage you and motivate you to continue to stick with it. But it is a very, very rewarding profession.
Definitely.
So
And you can reach out.
Sorry,
You can
good.
reach out to us through our email address, which is bota, bota.bda@gmail.com. And then we can also answer any further questions in regards to this lady's daughter.
Okay. So let me ask you this, what motivated, I'll ask a question and each of you could answer individually. What motivated you all to get into occupational therapy? I'll start with Miss Akilah Lapsley-Dyer.
All right. So for me, I did not know what occupational therapy was. I had never heard of it as a student. While working with labor and training as a summer student, I was doing a job survey, and they were trialing this survey on myself, which related to an aptitude test. And occupational therapy was one of the professions that came up. So as it was something new, I researched it. Found that it kind of fit within my criteria. I always wanted to be in healthcare or some sort of helping profession. And I did not want to go to school to be a doctor. That was just too much. So I researched it. I actually was a candy striper, and I also shadowed at the hospital. So I got exposure to what OT was. And then I went overseas and did my undergrad as stated, and then decided that this is definitely something I want to do, and went on for my master's. And I haven't looked back. It was a great decision for me. So.
Sorry, Mr. Famous, we lost you.
We can't hear you.
I bet. What motivated you to become an occupational therapist?
Okay, so for me, I started out in candy striping, just like Akilah, and I was exposed to a lot of different professions in the hospital. And through that, I found that I was interested in definitely helping people, but I got more drawn to the rehabilitation side of things. I wanted to do a bit more than just help people in the hospital. I wanted to take it further. So I started to look at different professions that were available, and I stumbled across, all the allied health professions, OT, physical therapy, speech language pathology, and I was torn between physical and OT. I had gone to one of my high school's school fair, and they had a competition on how to say my university's name. I happened to get it right, and they only offered occupational therapy there. So I had looked at a number of different schools to see if I wanted to do physical therapy, but I was drawn to occupational therapy. I looked more into the research and I felt that that was the best fit for me. I was allowed to work in a lot of different areas, which I really, really enjoyed. And then after I started at Quinnipiac, I did my bachelor's and master's there. And then I worked in Florida for a number of years before I came back. And while I was back, I was working at MWI, King Edward, and now Department of Health. And during that time, I decided to go back for my doctorate. I wanted to do something a bit more. And I went back to Quinnipiac to get it in 2018.
Okay, so I'm just gonna bring up a few pictures, and you could just describe to the audience some of the stuff that is happening in these pictures. Um,
So
so
a
what?
hand.
Sorry, go ahead.
So this is something that we would use for somebody who possibly may have had a stroke or just needs to work on using both their arms together or building strength in their upper body, specifically their shoulder area.
Also for endurance.
Okay.
So this may be seen in an acute facility or a outpatient setting or inpatient day hospital type setting where the OTs will be working on improving like physical dysfunction, improving endurance, like I said, activity tolerance, things of that nature to get the patient moving.
Okay. And this one?
Similar to the last picture, this is a bike used for exercise as well. A lot of this will speak to more physical dysfunction, so any type of physical related injury. But OTs do work in a lot of different areas, including spinal cord and brain injury, where they may use some of these machines or equipment to handle some of the issues that the person may be experiencing.
Okay. And this one?
Oh, a hand pulley. We can use this, or I used it a lot with individuals with stroke, just to get that motion back, especially for preparation activities such as getting dressed. So learning how to push your arm back through, but you don't have much movement in that arm through lack of awareness, through nerves, etc. So just getting that strength back through activities such as that.
A few years ago, my mother-in-law she suffers from diabetic, and she actually lost mobility of her arms and legs for quite some time, and she was in the hospital for about just a year, just in rehab. And the machine that this machine was one of the machines that I shouldn't say machine, but one of the items that I saw her having to use on a daily basis just to get back movement of her arms and legs, you know. So I say that in the sense that one of the challenges we have, especially in the Black community, is that we have this propensity for high blood pressure, kidney failure, diabetes, stroke, and then sometimes people who have diabetic, they actually lose the sight or they lose mobility of the thing. And do you all see a rise in that happening?
Absolutely. There's definitely a rise in those conditions, especially diabetes. Like you said, Black people and people of color are predisposed to a lot of the issues that you mentioned, which can lead to more severe issues like stroke, brain injury, and things of that nature. And you will need some type of rehab, and then especially occupational therapy. I like that you brought up that machine again, because it's important to note that although a lot of these things look like exercise, there's a lot that goes into it.
Right.
We're not just, oh, we just need to get you moving. It's more than that. We have to understand the muscles. We need to understand where they are. We need to understand how they work. We have to understand what it is about the brain that is telling the muscle not to do what it needs to do. We need to know what it is about, like what the brain is having issues with. We need to know what the brain is controlling. We need to know about the spinal cord and what parts of the spinal cord have been affected. All those things come into play when we're delivering our services. So some people may get it confused where it looks like, oh, we're just exercising. We're truly not. There are certain things that we are focusing on to help that person succeed in a particular area, and it's building on the next skill and the next thing so they can do something.
And also, one, everything's always individualized and it's tailored to whatever the goal of that individual. So if this individual had a specific goal of they want to be independent in dressing again, so every activity that we do is tailored to ensure that they do that, even though at times it may just look like exercising or playing is what I get a lot when we work with children. Oh, you're just playing games. No, there's a reason and strategy to what I'm doing and why.
One of the things is, like you said, we as you said, for a younger person or for children, they've never did this before, and so it's easy to, well, I shouldn't say easy. They've never did it before, but for the adults who did it before, they've lost their sense of independence. I can dress myself. The other day, I had a pinched nerve in my lower back, and I had a challenge just putting on my own clothes. It took me, what would have took X time, took X times three. And I say that to sense that a lot of times we find our in my case now, our parents or our parents' generation, the mobility is slowed down, or they're not able to do the simplest of things, what used to be simple. And you can see the I would say, I don't want to say pain, but you see the stress on their face, like, oh, I can't even open this bar of peanut butter anymore, type of thing. And are they getting occupational therapy? No, they're not. So sometimes pride prevents us from even asking for help. So in Bermuda's case, how do people who need help reach out for help?
It's so in most countries it's very similar. You would reach out to your doctor for a referral to us, but like we said earlier, where you discussed what is it that we can do to prepare ourselves as we age, you need to talk to your family. You need to find your supports. You need to have people check on you. Like you said, Bermuda's very prideful. Elderly are very prideful. They will stay home and not tell anyone what's going on.
Mhm.
And we need to start having those conversations, because we don't want people to be staying in their homes sick, immobile, not eating, things like that. We don't want those things happening. So you need to have a support, you need to have an advocate, you need to have someone to speak for you and to check on you as you age. Same as going to your doctor. Most people don't like going to the doctor. Most men do not like going to the doctor. Please
Yeah.
go to the doctor, especially as you age. Just because you don't know doesn't mean it's not happening.
And stemming off from that, pride and stigma in Bermuda are two big things. Myself and Ms. Douglas-Sampson, we both worked at MWI. So the stigma and fear of people seeking support and help that they need for fear of how outsiders are going to see them or be labeled. So definitely pride and stigma in Bermuda are two big things in getting access. So once you minimize both of those, referrals from the doctor, as well as for us working with children, referrals from Department of Education. I'm sorry, Ministry of Education.
Are you starting to see a lot of the, I don't say a lot, but are you starting to see some of the people putting us increase in people putting aside their pride in order to say I need help, or are they waiting until it's too late?
It's a bit of both. I think sometimes it takes some time. Initially, when you may work with someone, they're going to be resistive, and you have to work on building a relationship with them where they end up trusting you, and they realize that you're really just there to help them. So it can be tough in the beginning, but eventually people will let their guard down and actually tell you what's really going on, and we most likely will see it before they're even ready to tell us. So we will wait, but we're still there to let them know, like, when you're ready. But if they take too long, we will definitely be trying to encourage them that this needs to be done. It needs to be done now. Please think about it. Like, we don't leave people out there.
Do you ever have to get to a point where you speak to a family member, as a point of intervention?
So
Like,
yes, so we work not necessarily through a medical model. We work through a holistic model. So that involves everybody that is involved or around that individual. So whether it's a child or a senior adult, whoever is within their vicinity that they would need assistance or support from, we have to communicate with them. For those who don't have a family member, it could be a social worker, foster parents, anybody who's involved with that individual. Teachers. So yeah.
As long as consent's been provided to us at the beginning, we can make those contacts. So, like, Bermuda is also very community based. There are a lot of programs that we work with out here that can help people, like age and disability services, like you said, like PALS, Medical House, Red Cross. We have all those things at our access, but we like, people in the public or people in our community don't necessarily know about them and don't know what they can actually get from them if they needed it.
Mm-hmm. I see. So as we start to wind on, so again, you're having, I don't want to say the name of the event. Just help me out, work with me a little bit. What's the name of the event that you all are having coming up?
It is the 35th.
Yeah.
35th World Federation of Occupational Therapists Executive Team Meeting and Council Meeting, Bermuda 2024.
Okay, because one of my cousins, when they found out that you were going to be on the show, she's from the Virgin Islands, and she was stating that they have a need. Sorry, to be clear, the British Virgin Islands, that they have a need for more occupational therapists there. Do you have amongst the overseas territories, i.e., Cayman Islands, British Virgin Islands, Turks and Caicos, do you all have affiliates with them as well?
So the Caribbean Occupational Therapy Association is made up of all those islands in the Caribbean. We do have contacts to them, but we are not part of that association because we're in the Atlantic Ocean. But we do have contacts through them. We can contact the American Association, we can contact the Canadian Association, we can contact any association, and they can reach out to us as well.
Okay. All right. So are any because this show is broadcast in the Caribbean, or do we have any of the delegates? Are they coming from the Caribbean?
I believe we had received an email from one. So we haven't heard back if they had confirmed, but I don't know the countries right now of who's coming. I will know in a couple days, but right now I don't know all the countries that have signed up to come.
But there are some that go out as far as Africa, UK,
China,
everywhere.
It's all over the world.
Yeah.
Okay. Well, I want to, as a Bermudian who's not graying yet, I want to thank you for all that you have done and all that you will do for the people of Bermuda. I want to thank you on behalf of my co-host, Speaker Shirley Osborne from Montserrat and Shana Smith Archer from the Virgin Islands for taking your time to educate us on Territories Talk, because one of the things that we have to do as people is don't just go for what I saw on TikTok or stuff like that. That's 2 seconds of, not 2 seconds, but that's 60 seconds of why I saw it on TikTok. Whereas we actually get to speak to those who have dedicated their lives and put their professional careers focus on helping others. So I just want to thank you, thank you, thank you, thank you. And I want to give a special
Thank you too.
shout out to the people in the Cayman Islands, in Cayman Marwood. Also Miss Sheila Cable, she's tuning in from St. Kitts. Miss Everhart, I'm not sure where she's tuning in from.
Bermuda.
Bermuda.
Oh, okay, you know her. Shayna Smith Archer, she is from the Virgin Islands, but she is somewhere else tuning in. Miss Maureen True, I'm pretty sure she's a Bermudian lady. I think I know exactly who she is. But those who didn't put comments up, I want to thank you all for tuning in. We can see how many people are viewing. And I just want to thank you again, ladies, for taking the time to educate us. Do you want to give any shout outs to anyone as we close up?
I don't know.
No.
Then probably just
OTs of Bermuda.
Yes, Bermuda Occupational Therapy Association, all our local OT students that are out there studying. You're almost there. And I guess the World Federation as they're coming in.
And the Bermuda Occupational Therapy Board.
Okay.
Yeah.
Well, Miss,
Okay.
both of you, I want you all to give your regards to your parents for me. Because as the old people say, I know your mom and daddy, you know. So thank you once again. And this is sorry, 1 minute. This is Territories Talk. Our next show will be on next Territories show, maybe on Wednesday. The other one will be the following March the 3rd. We will have Bermudian Franco Harris, who is also studying at Oxford, getting his PhD, and he's looking to give therapy in a different way towards another situation that we have going on in our, not just our country, but in the region. But the whole purpose of Territories Talk is to highlight to our sister islands that whatever's going on in your island is going on in our island. And we don't need to continuously, oh, we got to bring somebody in from England. No, we don't. We got all the professionals we need right here. Oh, there's somebody put this up. Is this your Facebook
That's
page?
us.
See?
And we have an Instagram page as well. So yes.
Hey, you want Insta too? Okay.
Yes.
Well, like I said, we for those in our sister islands, if you all need to reach out to your, do you all call yourselves? How do you amongst yourselves? What do you call yourselves?
OT.
OTs, the OT community.
We're OTs. Yeah.
All right. Well, thank you and have a blessed weekend. Be safe, everyone.
Thank you.
Sure.
You as well.
All right.
Bye.